First of all, I would like to address why we need biomarker in breast cancer. We have a clinical decision that are in early breast cancer based on the decision to add additional treatment over another treatment. In particular, we have to decide which ER-positive, ER-negative patient need additional chemotherapy compared to endocrine treatment at all. And this is a major issue. For understanding which patient can really benefit from this treatment, there are two parameters that we are going to use. One is the risk of relapse, that is called prognosis. And we are not really interested in the prognosis by itself, but the prognosis after an endocrine treatment, because the patient cannot be cured twice. So if a patient is cured by endocrine treatment, they don't need to receive additional chemo. The other point is, even if you are at risk, if the chemotherapy doesn't work, you don't need to receive chemo. And this is called the need of predictive marker of benefit of chemo. And using both of the two, we can improve our decision making, and that's why we develop a genomic tool to help us to improve what we have done so far with the clinical variable. This is an interesting issue because the clinical question that we have depends on the clinical decision that we have to make. So till some years ago, there was not the clinical issue to decide about longer endocrine treatment. So we was not really interested to understand which was the patient that have a late recurrence, because we didn't have a different therapeutic strategy. So at that point was just needed to know the prognosis itself, but didn't have any impact about the clinical decision. Predicting late recurrence became relevant after the release of the data to show that longer endocrine treatment improve patient outcome. And exactly as the chemotherapy that we have discussed before, not all the patients need an endocrine treatment. And again, the patients that don't need an endocrine treatment are those that do very well without an additional longer endocrine treatment, or the patient that they don't do well with endocrine treatment, so they don't need an addition of other endocrine treatment after 5 years of standard treatment.